So chin lipo can be a very powerful tool in improving the contour of what we call the cervical mental angle, which is basically the angle between the jaw and the neck. So the ideal is that we want to remove fat. We want to get the skin to sort of essentially contract itself and to define that angle very nicely. However, one thing about neck liposuction is that's quite different than neck lift. Neck lift, for the most part, the work is done for you. The muscle's already pulled, the skin is pulled, and obviously, there's not a whole lot that the patient needs to do short of just protecting the area and basically wearing an appropriate compression garment around their chin and neck. In neck liposuction, which again, we're trying to avoid making all the bigger scars or making the bigger dissection, we actually really rely on the patient doing the post-procedure care to get the results that they want. And if somebody just is not familiar with what they need to do, sometimes the result can be a little bit disappointing. So for the most part, like with any other part of our body, when we do liposuction, the goal is to provide even compression on the underneath area of the jaw. We have to make sure, one of the things that sometimes I see is that the way people wear their chin garment or the way they wrap their some around the jaw, the skin gets folded up and now they get excessive skin here in the front, while right here they get nice tight skin that sometimes even feels hard. So one of the most important things that you have to be fully aware of how your skin is draped underneath the garment or whatever tool you're using to pull the skin up. So you want to make sure the skin is always sprayed out like this and is essentially doing the same thing that a neck lift is doing. So you're basically pulling the skin and you're almost pulling up the skin from this side, and then you're putting your garment in there. Sometimes for people who have excess skin, it's actually a good idea to use tape. Sometimes before you put the garment on, it's good to put a piece of tape, a medical piece of tape that is non-allergenic, that doesn't affect your skin. Put one end of it here and put the other end of it back here and pull it up before you obviously stick it to behind your ears. That really will do a nice job of doing the work for you, making sure that the skin is spread out and nicely. Make sure that before you put your garment on, you like how the skin is sort of sprayed out and how this angle is forming. And then you early on put a foam in there or a pad in there and then put your garment back on. That can over time produce very good results. Also, getting massages in your chin, especially if you feel like you have a lot of swelling, is going to be helpful. Keep in mind that the opening in the chin primarily is going to be here. We sometimes make openings behind the ears too, but those ones we close. This one remains open to help your masseuse and you to try to drive out any fluid that may be collecting underneath your chin. If we drive out the fluid, if we provide even compression and drape the skin nicely, you can get amazing results from neck liposuction.